Hello, I am Allison Payne. I lead a lab at the University of Utah in the Department of Radiology and Imaging Sciences, where we are studying how we can use high-intensity focused ultrasound to treat breast cancer, and that is what I will be speaking about today. Now, breast cancer is the world's most prevalent cancer. According to the World Health Organization, 7.8 million women in the world have been diagnosed with breast cancer in the past 5 years that are still living. If you look at it on an annual basis, 2.3 million women were diagnosed with breast cancer in the year 2020, and 685,000 of those women died. Now, while breast cancer is most typically diagnosed in older and middle-aged populations, there are young women and men that are diagnosed every year. Indeed, as a woman, you have a 1 in 8 chance of being diagnosed with breast cancer in your lifetime. Now, if you live in a wealthier nation where screening programs are more prevalent, you have about an 80% survival rate of your breast cancer. Unfortunately, this rate will decrease depending on where you live. In countries with smaller income levels, where screening programs are not as widespread, you may only have a 40% chance of surviving your breast cancer. So obviously there's a large discrepancy here. So it is a worldwide health issue that needs to be addressed, and there are definitely room to improve breast cancer treatments. Now, before I discuss how high-intensity focused ultrasound could potentially be used to treat breast cancer, I think it's good to understand the standard of care today and how we got here. Now, this gentleman, William Halsted, he was a physician that practiced in the late 19th and early 20th century. And he was very important. He advocated for aseptic surgical techniques, and he also introduced the use of widespread anesthetics during surgery. He also developed the first surgical residency program at Johns Hopkins University. For the purposes of this talk, he's quite important because he performed the first radical mastectomy in 1882. Now, this was quite a morbid procedure for the woman. You removed not only the breast tissue and the lymph nodes, but also the underlying pectoralis major muscle. And so, as you can imagine, this was quite disfiguring for the woman. But however, it really maintained as the standard of care for many decades after this. This is a very interesting paper that Dr. Halsted wrote back in 1898, and it described the cases of several women. It was several case reports as well as pathologic descriptions of what would happen in the breast cancer. And for these women that underwent the radical mastectomy, he reported that there was a 54% 3-year survival of this breast cancer. Now, there was movement after this to improve the breast cancer treatment for women. The National Surgical Adjuvant Breast and Bowel Project, or NSABP, was founded by 23 surgeons back in 1957, and their goal was to improve breast cancer treatment. They partnered with the National Cancer Institute in the United States, and they launched several large multi-site trials to study this. In clinical trial NSABP-B04, they were comparing radical mastectomy that Dr. Halsted introduced to a total or simple mastectomy. Now, a total mastectomy removes only the breast tissue and the lymph nodes, and they devised a clinical trial that compared the radical mastectomy to this total mastectomy, both with and without radiation. Now, as you can see in these plots, the interesting thing was there was no survival difference between women that underwent these two mastectomies. And so the standard of care at this point was changed to total mastectomy only. And you'll notice that this was published many decades after the radical mastectomy was introduced in 1985. Now, the NSABP, they continued towards more breast-conserving surgeries. And so when they launched NSABP-B06 in the 70s, they were comparing the total mastectomy to a more breast-conserving surgery of a lumpectomy. Now, a lumpectomy removes the tumor only and the surrounding margins. And as you can see in these plots, there was, again, no difference between the two techniques. And so when you compared the lumpectomy to the total mastectomy, there was no difference in treatment survival. And so once again, the standard of care was changed. This was published in 2002 to a breast-conserving technique where you remove the tumor with lumpectomy followed by radiation therapy. So today, the breast cancer standard of care, it's really a function of cancer stage, patient age, and the health of the patient, as well as the genomic profile of the tumor. And it's applied as a combinatorial process. So treatment, depending on what you have, it could be a combination of surgery and various therapies such as chemotherapy, radiation therapy, hormone therapy, and targeted therapy. And again, the treatment is quite effective, and most women do survive their breast cancer. However, there are many long-term effects that women still suffer with, and these can range from fatigue to lymphedema to depression, not to mention the financial strain that this can cause for women and their families. So clearly there is still room to improve breast cancer treatment for women. So high-intensity focused ultrasound is a wonderful non-invasive technology that is able to deliver energy to places deep within the body. And this can be used to treat breast cancer in a couple of ways. Some women may be interested in having high-intensity focused ultrasound to treat their local disease for their tumor only. So this could be advantageous in that you are furthering the breast-conserving nature of breast cancer treatment by non-invasively treating the tumor. It could also be effective for people who have more advanced breast cancer, and this could be used as a combination strategy for treating metastatic disease. So this could be used as a modality to help deliver drug delivery locally to the tumor. It could also be part of an immunotherapy effort. Now, focused ultrasound can be applied with several bioeffects. For the purposes of this talk, I will be talking mainly about thermal high-intensity focused ultrasound and mechanical high-intensity focused ultrasound. So to simplify this, just to get the point across, there are a few ways you can apply high-intensity focused ultrasound that are advantageous for treating breast cancer. Now, if you want to just thermally necrose the tumor, if you're wanting to treat the disease locally, you will want to perhaps elicit a thermal bioeffect. Now, this is often done by applying the ultrasound in a continuous wave mode, where you have a 100% duty cycle and you're applying it over tens of seconds. Now, this can happen with low to high ultrasonic intensity. And again, your objective here is to coagulate the tissues in interest with thermal necrosis. Now, you could perhaps reduce the duty cycle, perhaps to 50%, and could apply this in milliseconds to seconds, and you could use low to moderate ultrasound intensities. Now, in this case, you would still be getting mainly a thermal bioeffect, but you might want to be doing thermal heating that is non-necrotic, so perhaps a hypothermic effect to stimulate drug delivery or other issues. Now, HIFU can also be applied mechanically. So when you do this, you really shorten the duty cycle, perhaps to 1 or 2%, and you have millisecond burst lengths. Now, this can be done to low to high ultrasound intensity. And this is quite interesting because there's several bioeffects that you could generate with this. You could look at cell lysis, or you could increase the vascular permeability, or even sonoporation. And in different work I'll be presenting later in this talk, you will see how all of these are applied. Now, I'd like to start off by describing one of the first studies that was done to treat breast cancer with high-intensity focused ultrasound. And in this first application, they were actually treating benign breast tumors, which are also known as fibroadenomas. Now, this very interesting study came out of Dr. Kullervo-Hunninen's group at the Brigham and Women's Hospital. So they developed a system for high-intensity focused ultrasound that was actually MR compatible. So this was an MRI-guided high-intensity focused ultrasound system. And you can see it here on the left, where you had a transducer and all the components to manipulate the transducer that was built to be MR compatible. So because it was done in an MRI, you could use the MRI to visualize the tumor before treatment, as well as for monitoring and assessing that. So on the right, you can see the fibroadenoma in the patient. You can see the transducer, and they could then plan the treatments. Now, the objective often with treating benign tumors is to debulk the tumor as well as to treat the whole thing. So there were a few interesting things that came out of this study. First, they were able to show that the MRI was able to successfully monitor the lesion. So you can see a focal spot here that they were able to visualize using MR thermometry. Now, they were able to do this in 88% of the sonications, which was really quite high. They were also able to track the assessment of the fibroadenoma. So on the right in these 4 panes, you can see how the fibroadenoma looked in pane E 2 months before the treatment was done. And then as you go on 7 days after, 6 months, and 3 years, that the fibroadenoma is no longer enhancing in this contrast-enhanced T1 weighted image. In fact, you have a hypointense region where the tumor was treated. So this was a very pioneering study that demonstrated the potential of this technology to treat breast disease. Now, while that previous example was an MRI-guided approach, you can also treat breast cancer under an ultrasound image guidance. And there are several devices that are available on the market, either for purchase or for clinical trials, that are able to do this. The first device is called the EchoPulse device, and it's developed by a company in France called Theracleon. And it's a very elegant device, as you can see here. It has a treatment arm that has an active skin cooling module in it so that you can place this arm right up next to the breast. Now, it's able to treat the tumor with a 3 megahertz frequency transducer, and then they have different transducers that are used for imaging that give higher resolution at higher frequencies. You also have this system, which is the Model JC system that was developed by HIFU in Chongqing, China. Now, this system similarly is under ultrasound guidance, and it has a 1.6 megahertz transducer and then a higher frequency for imaging. And there are several studies that have been completed with this device, and I will go over them later in the presentation. Now, conversely, like the first study I was demonstrating from the group in Boston, there are several MRI-guided HIFU devices that are appropriate to use for breast cancer. The first device is the Exablate 2000 and 2100 system that's developed by Insightec located in Israel. So this system is actually built inside the MRI table, as you can see here on the right. Now, this has a transducer that has a 1.1 megahertz frequency, but there's some leeway in the frequency you can use during this treatment. And not only is it appropriate for treating breast cancer, but it was also used and is also used to treat uterine fibroids as well as other tumors on the body. So it's quite a versatile system. You have a couple breast-specific systems that were developed. So this one here was called the Sonolive, and it was developed by Philips, which is now Profound Medical. Now, the interesting thing about this system is it has a wide aperture transducer, as you can see on the far right. And it's laterally shooting, so it shoots into the sides of the breast, which is quite advantageous for several reasons. They also, because they have this wide aperture transducer, they're able to ablate larger volumes, which can be nice because it can reduce treatment times when treating larger tumors. This last system is called the MOOC system, and it was developed by a group at the University of Utah in conjunction with image-guided therapy in Bordeaux, France. Now, it's a laterally shooting transducer as well, although it is a narrower aperture transducer. It also has a few other features. It has the radio frequency coils necessary to get high signal-to-noise ratio images in the MR built into the system. It's also designed to set on top of the existing MR table, and it has currently been tested on Siemens magnets. Now, ultrasound-guided breast HIFU devices, they operate in the manner seen in this paper that was published by David Brennan at University of Virginia. So as you can see here, you have the fibroadenoma really easily visible on this B-mode ultrasound image. Now, the physician can denote where the fibroadenoma is as well as the skin layer. And the software will then automatically devise a treatment plan to treat this fibroadenoma, as you can see there on the right. Now, this can be altered by the physician as they see fit. As the treatment progresses, you can again visualize the fibroadenoma. As these sonications occur in a serial fashion, when the sonication is actually occurring, you have kind of a large grayscale disturbance. However, Immediately after, you can see that you were able to get a hyperechoic mark in the tumor. So this can tell you if that particular sonication was successful before you move on to the next one.